Hi everyone, I'm Dale Smith, aka Journo Dale, and we're here to talk about Canadian politics. I'm here this week with Professor Mike Moffatt from the Ivey School of Business and from the Smart Prosperity Institute. And I figured we would talk about basic income because that is what is on a lot of minds right now, both with the PBO report this last week, as well as resolutions at both the Liberal and NDP party conventions. So first of all, Mike and I have both written columns the last few days profiling how problematic some of these proposals have been, particularly because many of the models look to basically cut a lot of supports that high needs individuals would need, thereby disadvantaging them. In other cases, I'm pointing to things like the jurisdictional challenges. There's very little that the federal government can do to create a federal basic income when most of these supports are at the provincial level. And so I figured I would just get us started, Mike, with this notion that everyone keeps saying to me that Ontario proved that this was working. There's the Manitoba income results. I think it was Finland had a study that is showing results. And so I thought we should just unpack some of those and why not everything is necessarily translatable.
Yeah, so thank you for that. I think with all of these, you need to get into the details, right? You need to sort of figure out what is it that you're trying to accomplish, and how were these sort of pilots designed. So the Ontario one, I think, is a sort of prime example of how these things can be really misleading. So in the Ontario pilot, it was an opt-in pilot, and that's a really important thing to understand, that people could choose whether or not to participate. And how it worked is, if you were on Ontario Works or ODSP, Ontario Disability, you could opt to not be in those anymore and take the sort of basic income instead. Now, for the people on ODSP, the basic income paid more, right? You got a larger check than you did on disability, but you lost a whole lot of health benefits. You got to keep your drug card, but you lost, what are they called? Medical necessity supports. So if incontinence supplies, diabetes supplies, you lost the money that you get to feed a seeing eye dog or a support animal. Like, there's a whole list of things that you would lose. So what happened was, first of all, they tried to enroll people in this pilot, and they spammed out all of these letters in Hamilton and different areas. They sent out 37,000 letters, and like 150 people signed up, right? So a sign-up rate of like less than 0.5%. Like, nobody wanted these things, and they concluded that the letters just looked kind of spammy, like it looked like a scam, which may or may not be true. They never really tested that.
Yeah.
But anyhow, so what the Ontario government did at that point was then work with a bunch of civil society organizations and said, "Hey, could you identify people who would be a good fit for this?" And they managed to enroll a bunch of people. But the really important thing to understand about that is that's not a randomized control trial, right? They specifically cherry pick people who would be good for this. And surprise, surprise, at the end of it, they found that the people that they thought would be helped by this program were helped by this program. And, I guess that's somewhat useful, but it doesn't tell you about how that would work if you spread it out over the entire population, because anybody who was harmed by that program didn't enroll in the first place, because it would have been highly unethical to enroll them.
Yeah.
And that's what happens over and over again with these pilots, that they cherry pick the people who are in the pilots. It turns out that, yes, these things work for those specific people, but you can't generalize that over an entire population. And on the Ontario pilot, it was particularly problematic for people with disabilities that were higher needs, right? So it basically transferred money from higher needs people on disability to lower needs people on disability, which isn't a great model, to say the least.
Yeah, no, for sure. The other thing that everyone keeps referring to is, there will obviously be some kind of economic stimulus effect for these low-income people who are now able to more participate in the economy, as well as the fact that, you know, the reductions overall in the costs of poverty would obviously make this a net benefit overall. And you know, I know that these are complicated questions, and I'm wondering if you can just try and unpack that a little bit in terms of why we can't just kind of hand wave this away.
No, we can't. And I mean, we've looked at, we had the Quebec government, you know, had a really lengthy study about basic income and found that, yeah, there were benefits, but there were other sort of more targeted programs that got you better bang for the buck. The British Columbia government did the same thing. You know, the study, you know, had I think 4 or 5 different academic studies looking at the issue from every possible angle. Had a summary report. The whole thing cost like $2.5 million. Over 1 million words on this thing, and they said, yeah, you know what, this has some benefits, but there are better ways of doing this. And you know, this idea that there's going to be all of these cost savings from basic and or any poverty reduction measure, there's not a lot of evidence for that. And frankly, I get really concerned when that's the goal. And the reason why is we've seen during this pandemic, health decisions made for like who gets to use ventilators and who gets vaccinated and not, made to maximize the cost benefits. And, you know, this basically at some level turns into a question of eugenics, where there's like, okay, people with disabilities are too expensive to allow to live. So we're going to save money by, you know, giving the ventilator to an able-bodied person and, you know, rank lower down individuals with disabilities, particularly severe disabilities, because they don't work and they're a drain on the system. So just let them die and we'll save a bunch of money. So this thinking,
and more to be clear, this wasn't really happening in Canada. This was happening in
this was more well, this was more of a UK discussion, though. This is actually, you know, Ontario did come up with these sort of triage discussions. So I would say be very careful when when you go down this road and say, okay, we should make our social support decisions based on the cost impact that they'll have on other programs. Because if you do that, that turns you down some very dark roads. So I would suggest we should help people, not because we think it's going to save money in social supports, but we should help people because it's the right thing to do. Right. And if it costs more, to keep somebody alive or not alive, we should just do it and not go down that road. So I get really concerned about this. And overall, there's not a lot of evidence that there is, in the long run, significant cost savings in other programs. Some areas you gain, some areas you lose. On net, it's hard to say how this turns out.
Yeah, and it's really hard to gauge the long-term impacts as well, in terms of things like crime rates and so on and so on as well. So I think that makes it hard to make that the winning argument for a case like this.
Well, absolutely. And, a perfect example of all of this is, back over the last 20, 30 years, governments have rightfully tried to reduce the amount of smoking in society. A number of programs have been hugely successful, and it's been an absolutely wonderful thing. But I went to a speech once by one of the big pension funds, one of the big public sector pensions. And he said, well, look, we used to have this implicit deal with our members that they would pay into the system and they would smoke themselves into an early grave and keep costs down. And they reneged on this by staying healthy and living longer than we had agreed on, which made us have to pay out more. And in fact, we've seen over time, things like CPP premiums go up over time because of these longevity effects. Yeah. So, this is an area where we had the social program, which was incredibly successful and I think incredibly beneficial to society, but it ended up costing our governments more. And I say, that's okay, but just understand that correlation is not perfect. Like, it's not good outcomes cost less, bad outcomes cost more. The world is a far more complicated place than that.
For sure. I guess one of the other things that I wanted to note in this is, and I'm not sure this is necessarily for your benefit, but so there is a private member's bill that a Liberal MP has put forward about a national strategy on basic income. And I just wanted to kind of unpack that a little bit for viewers in that national strategy bills are what backbencher MPs love. They are largely performative, and because they tend to be things of areas of provincial jurisdiction that they can't actually do anything about as federal MPs, they like to come up with these national strategy bills to try and get everyone on board for whichever particular social program that they're really interested in. In this case, it's basic income. And so this is one of those things that I think just kind of nuances that discussion a little more as well, because even if this does get debate, and I think she's fairly high on the order of precedence, so it will likely see debate. But this is one of these bills that even if it passes, and it very well could, because I'm sure the NDP would support this as well. That doesn't necessarily mean it's going to go anywhere, because as much as it would obligate the federal government to open, to meet with provinces, there's no guarantee the provinces are necessarily going to take them up on this, particularly when we're also dealing with pharmacare and childcare and long-term care and all of these things in provincial jurisdiction that the federal government wants some action on. The provinces don't necessarily either. And I think, I guess I just bringing this back to you, the confluence between what the federal government is able to do on this and what provincial governments need to do on this is pretty wide, in terms of there's very little a federal government can do about this. And I wonder if you can just kind of give us a bit more of a lay of the land in terms of why it is that there are few federal supports that would be relevant to a basic income discussion, whereas I would say a good 95% of this is all provincial.
Yeah, well, it really depends on what you're trying to do. Like, if what you're trying to do is what the Ontario pilot tried to do, is say, okay, we don't like how Ontario works, we don't like how welfare, we don't like how disability works, and there's really good reasons not to like how those work. I mean, they are drastically underfunded. They put all of these conditions on, like, they're horrible programs, and I don't want to seem like I'm defending the status quo.
Right.
I'm certainly not, for any case. If the goal of a basic income is to replace those, then you have to do it at the federal or the provincial level, because those are provincial programs, unless you're going to get 10 provinces and 3 territories to always agree, which never happens in Canada. Yeah. So all that the federal government could do is basically make some of our existing cash supports more generous. And, we have a few. We have like the GST, HST credit. We have the basic personal amount, which is the sort of amount of money you can keep before you have to pay taxes. There are a few things here and there that you could combine into something that replaces, that puts more money in the pockets of lower income Canadians. And I actually think there's a lot of merit to that. But that's not going to replace Ontario Works and ODSP and all of those provincial things. It can't, just because the federal government doesn't have jurisdiction. So it really comes down to, what is it we're trying to accomplish? And I think that's my biggest frustration about this whole debate is, we've decided that, we pick the tool first and we're deciding how to use it. We're like, okay, I've got some scissors and now I'm going to figure out what to cut. And that's not a good way to do a public policy. We should work from the other way and say, okay, what is it that we're trying to achieve as a society? Are we trying to reduce poverty, help people with disabilities? And then let's figure out the best way to do that. But start with the problem first and then find with the solution, rather than going, okay, here's a solution I came up with, let's find a problem to apply it to.
Yeah, no, for sure. All right. Well, thanks for taking the time to do this. It's been great chatting, and hopefully we'll do this again in the future.
No, I look forward to it. Take care.
All right. Thanks. And that's everything for this week. Join us again next week for some more Canadian politics. I'm Dale Smith. That's at journo_Dale on Twitter. And don't forget to like the video, share, subscribe, and support us on Patreon. Thanks, everyone.